Shalom, 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 Yasha'Allah. This your boy, Brother Shem wa Allah, back at you with another quick edifying video. Today's lesson is going to be called, If Any Man Have an Ear, Let Him Hear. If any man have an ear, let him hear. All right, first and foremost, I want to give all praises, honor, and glory. I want to say, Yahawah, Bahasham, Yahawashi, Bahasham, Rawchaa, Qadash. That's all praises to the Heavenly Father, whose name is Yahawah, and his only begotten Son's name, who you ignorantly call Jesus, whose name is Yahawashi. All right, and the Holy Spirit, which is the Rawchaa Qadash. Double honors to the apostles and elders of Great Millstone who have ruled well through the Spirit and have fed and edified the sheep in these last days, and has pushed this gospel and this truth to the four corners of the earth in these last days. A mighty shalom. Another mighty shalom to all you Akim out there laboring on the highways and on the hedges and on the unicorn, which is this internet, pushing this 100% doctrine, this 100% truth to the four corners of the earth in these last days. A mighty shalom to you all as well. Like I said, today's lesson is going to be called, If Any Man Have an Ear, Let Him Hear. All right. I came across this article. Actually, this was last night. This is from the Associated Press, right? And you understand that, you know, these movements that they're doing, that you see that they're pushing is leading to what? This all digital information, currency, the whole nine. All right. And ultimately, it's going to be leading to the MOTB. Okay. It's going to be leading to the MOTB. All right. So when I saw this, I was like, whoa. So this is, like I said, Associated Press. It says, Nero administration is launching a new private health tracking system with big tech's help. Okay. And it says, the Nero administration is pushing an initiative for millions of Babylonians to upload personal health data and medical records on new app and system run by private tech companies, promising that will make it easier to access health records and monitor wellness. Remember, we're talking about this thing is, listen, the MOTB, Revelation.17 is not just about buying and selling, but it's about tracking all your information. All right. And you see what they're talking about to make it easier. It says promising that will make it easier to access health records and monitor wellness. It says President Nero is expected to deliver remarks on the initiative Wednesday afternoon in the East Room. The event is expected to involve leaders from more than 60 companies, including major tech companies such as Google and Amazon, as well as prominent hospital systems like the Cleveland Clinic. It says the new app and systems run by private tech companies, promising that will make it easier to access health records and monitor wellness. Nero is expected to deliver Salakia. I'm sorry, let me jump down. It says the new system will focus on diabetes and weight management, conversational artificial intelligence that helps patients, and digital tools such as QR codes and apps that register patients for check-ins or track medications. Okay, so this is all, you know. Let's keep reading. It says the initiative, spearheaded by an administration that has already freely shared highly personal data about Americans in ways that have tested legal bounds. It says could put patients' desires for more convenience at the doctor's office on a collision course with their expectations that their medical information be kept private. It says there are enormous ethical and legal concerns, said Lawrence Gostin, a Georgetown University law professor who specializes in public health. Patients across Babylon should be very worried that their medical records are going to be used in ways that harm them and their families. It says officials at the Center for Medicare and Medicaid Services, who will be in charge of maintaining the system, has said patients will need to opt in for sharing of their medical records and data, which will be kept secure, right? And listen, you know, Esau, he's so slick about it, because just think about these apps that you do. These apps that you use now, they always ask, can we share your contact history, your photos, your microphone, you can't, like, all these different things just for a simple act that has nothing to do with anything. All right. And then listen, you can't move on, until you agree to these terms and conditions. Right. So they force that hand, of you. And a lot of people are going to be forced into that hand to do this. Okay. Let's see. It says those officials and patients will benefit from the system that lets them quickly call up their own records without hallmark difficulties, such as requiring the use of fax machines to share documents that have prevented them from doing so in the past. It says, we have the tools and information available now to empower patients to improve their outcomes and their healthcare experience. Dr. Mahet Oz, the administrator for CMS, said in a statement Wednesday. Popular weight loss and fitness subscription service Noom, which has signed on to the initiative, will be able to pull medical records after the system's expected launch early next year. It says that might include labs or medical tests that the app could use to develop an AI-driven analysis of what might help users lose weight, CEO Jeff Cook told the Associated Press. Apps and health systems will also have access to their competitors' information. Two, Noom would be able to access a person's data from Apple Health, for example. Right now, you have a lot of siloed data. It says patients who travel across the country for treatment at the Cleveland Clinic often have hard time obtaining all their medical records from various providers, said the hospital system CEO Tomislav Mihajic, I don't know. He said the new system would eliminate the barrier which sometimes delays treatment. It says their competitors' information, Slovakia. It says which sometimes delays treatment or prevents doctors from making accurate diagnosis because they do not have a full view of patients' medical history. Having seamless access to health app data, such as what patients are eating or how much they are exercising, will also help doctors manage obesity and other chronic diseases. It says these apps give us insight about what's happening with the patient's health outside of the physician's office, he said. CMS will also recommend a list of apps on Medicare.gov that are designed to help people manage chronic diseases as well as help them select healthcare providers and insurance plans. Digital privacy advocates are skeptical that patients will be able to count on their data being stored securely. It says the federal government, however, has done little to regulate health apps or telehealth programs, said Jeffrey Chester at the Center of Digital Democracy. Health and Human Services Secretary Robert F. Kennedy Jr. and those within his circle have pushed for more technology in healthcare, advocating for wearable devices that monitor wellness and telehealth. It says Kennedy also sought to collect more data from American medical records, which has previously said he wants to use to study autism vaccine safety. Kennedy has filed the agency with staffers who have a history of working at or running health technology startups and businesses. CMS already has troves of information on more than 140 million Babylonians who enroll in Medicare and Medicaid. Earlier this month, the federal agency agreed to hand over its massive database, including home addresses, to deportation officials. The new initiative would deepen the pool of information on patients for the federal government and tech companies. Medical records typically contain far more sensitive information, such as doctor notes about conversations with patients and substance abuse or mental health history. This scheme is an open door for the further use of monetization of sensitive and personal health information, Chester said. All right, so just think about this, all right, because all this information is viable, all right? And think about what technology has done, like even in the regular insurance, right? So now if they're able to track and do these different things, now what can they do? They can deny, your services. Well, you signed up for this health services, but we see that you traveled over to KFC and got a bucket of chicken. Right? We're not going to give you your medicine. We're not going to give you right. Remember, they're going to be able to track everything. It's not just buying or selling. All right. And a lot of people are going to be buying into this because they're going to talk about how convenient it is. Right. When you look at, and I had seen an article, this was a while ago, when they were doing insurance on houses. What were they doing? They would send drones to look at the houses. And if you had roof damage, the drone would come and look and see if there was roof damage. If there's roof damage, they're not going to give you house insurance. All right, because your roof can't be insured or whatever it was. Right. So just what more? Now they have all your medical history. They have all this different information. So now when you're trying to get something or services, we can't do that. Right. Well, we see that you did this or you didn't do this. OK. Just understanding, like, this is all about control. They continue to talk about convenience, right, in a way to make it easier. But ultimately, it's all about control. OK, it's all about control. OK, so now you think you might get, a health credit, or you might get money. Remember, all this stuff is leading to put everything into a digital kind of system for everything. All right. So like you say, now remember they continue to talk about the currency, right, going digital. Right now you have here your medical history as a convenience. Now you don't have to go from this doctor to that doctor to this records. It's all going to be conveniently all right there and stored. Right. So guess what? They're going to be instantaneous to be able to input all your information. All right. And it's going to be kept in that right hand or in that forehead, man. Right. This is all this stuff is leading, to this. Okay. Let's get this real quick. Matter of fact, before we get this, right, let's go to 2nd Esdras. Okay. 2nd Esdras chapter 15, verse 1 says, "Behold, speak thou in the ears of my people the words of prophecy." It says, "Which I will put in thy mouth, saith Yahawah Bahasham Yahawashi, and cause them to be written in paper, for they are faithful and true." Right? And these prophecies are being unfolded right in front of us, man. Okay? Right in front of our faces. All right? You see, all this stuff is what is ultimately leading to this new world order, right? Or this ultimate system where they're going to be able to track everything that you do. Okay. This is Revelation.17 verse 9. Says, "If any man have an ear, let him hear." Okay. And there's a lot of people who don't have those ears to see, ears to hear, or eyes to see. All right. So when these things like this pop up, they're not an alert to them. They're just thinking it's another news article and this is this, that, and the other. They're not seeing and putting this stuff together. All right. You have to have those ears to hear. All right. And ultimately, Yahawah Bahasham Yahawashi Bahasham Qadash have to give that to you in order for you to even, get this and get the prophecies and understand how this fits into the prophecy. Okay, because if now they got all the medical records. So now they got all that. They got all your, you know, your criminal history. They have all your medical history. They have all your financial history. They have everything about you, right? Then they have your current movements, right? Current spending habits, current, all this stuff, right? So that they can track you. Okay, like I was telling a brother, it's like, it's gonna get to the point where you're gonna be driving, right, or whatever. You're gonna be going to go pay for something, and especially when it's MOT. I'm just imagining, right? You're going to go pay for something. There's people who take this MOTB, and you're gonna go to try to pay for something, and they'll be like, oh no, sorry, we can't take your payment. And then you had to go in and check to see what was going on. All of a sudden, you had a $70 deduction or whatever it could be, right? You look at it, well, what was this? Oh, this is a speeding ticket. Well, what do you mean? That I didn't get pulled over? No, right? Because they're going to be able to track all that, man. They're going to track all. Remember, at this time you were going, 75 and a 55 thing, right? They don't need the cops to come get you. You're being tracked. Everything that you do, right? Oh, you were part of this health plan, but it looks like you went out to the Chinese buffet, So now we're going to cancel your health plan, right? Because you're not doing what you're supposed to be doing, okay? We're going to, or we're going to up your plan, okay? All this stuff, right, is all leading to that full control of what Esau wants, right? Starting with those top banking families, those elites on down, okay? So Revelation chapter 13, verse 16, it says, and he causeth all, both small and great, rich and poor, free and bond, to receive a mark in their right hand or in their foreheads, and that no man might buy or sell, save he that had the mark or the name of the beast or the number of his name. Okay? And like I say, it's not only just going to be just about buying and selling, right? All this stuff, because they're going to make it as it's a convenience. Right? No longer do you have to carry, or you have to go to your doctor, get this file and this thing together. It's all going to be digital. And you see that they're trying to, quote unquote, simplify it and make it easier for everybody, for access, as they say. Right? And how they're going to do that? By putting everything digital. Right? And ultimately, all that stuff is going to be able to fit that information into that RFID C-hip. All right, because this mark is charagma, right, which is a physical thing. Okay, when you look up the root word is karax, right, which is like a pail or a stake, something that you drive into. All right, you drive into something. All right, which is, you drive a wood stake into the ground. Okay, this device is going to be implanted. Okay, and it's going to have all this information. So you have he that has ears that can hear, you see this information and you know what's going on, how they're going to be using this, how they're going to use this to their advantage at the end of the day, okay? And they're going to be taking advantage of this, all right? So understand, they're pushing, right? Because what? The scriptures tell you, Revelation 12 and verse number 12, it says, therefore rejoice, ye heavens, and ye that dwell in them. Woe to the inhabitants of the earth and of the sea, for the devil is come down unto you, having great wrath, because he knoweth that he have but a short time. All right? So, yeah, he knows. You see, they're pushing this digital just globally, this digital just all around for everything. And they want everything to be digital, right? Because what? It's going to make it easier when it's time to implement, this MOTB, okay? So, I just wanted to do this when I saw this article last night. I was going to do it last night, but I was like, I'll wait, right? But we see what's going on, man, right? Those who have ears to hear, right? And those who have eyes to see, okay? That's why it says the spirit of Yahawashi is the spirit of prophecy, all right? To see and to speak before. And we've been speaking about this, for a while now. All right. Those who have ears to hear can understand. Those who have eyes to see can see what's going on at the end of the day. Okay. So with that, right, I just wanted to, touch base on that. So with that, I want to give all praises, honor, and glory. I want to say, Halal, Yahawah, Bahasham, Yahawashi, Bahasham, Rawchaa, Qadash. Peace and blessings to the elect of the 12 tribes scattered abroad. A mighty shalom to the 144,000 men. Double honors to the apostles and elders, a great millstone who have ruled well to the spirit and have fed and edified the sheep in these last days. Another mighty shalom to the rest of the elect out there. Stay diligent, stay focused, keep praying for one another, right? And understand, hey, this push is coming, and it's coming full speed ahead, all right? And with that, we say a ball, and shalom.